NHS public health teams are now working closely with local authorities during the transition year before the official transfer of public health responsibilities in April 2013. Margaret Carney, Chief Executive of Sefton Council, sees the huge opportunities of public health moving to local authorities and understands the issues faced.
I think there are huge opportunities from the transfer of public health to local government. The way I like to view it is that it's like public health coming home. A long history of strong partnership working has been very successful, even though they're in two separate organisations. But for me, the greatest opportunity is by integrating those two sets of organisations and skills and talents. What we'll be able to do is to make a tremendous input into reducing health inequalities. We have big issues with health inequalities, and it is absolutely disastrous that people's life chances are dependent upon where they live. And we must make inroads into that, particularly in a time of economic constraint where people are suffering from loss of jobs, etc., which will have a massive impact on their physical and mental health.
For individuals and teams, this will be a significant change in the way they work. So what are the differences and challenges of working in local government? Mark Palethorpe is Director of Adult Social Care and Health at Cheshire West and Chester.
I think some of the main challenges is moving to a different way of working, a different organisational culture. We must be clear that actually public health and local authority have a great history of working together, so this isn't something new. But actually the difference of moving into a political environment where a local authority that is led by elected members will be different to working in PCTs. The other thing to remember, of course, is that moving into local authority, we have great networks both in our third sector, in the independent sector. And the thing that public health teams can do is really utilise that and capitalise on those networks. So a workforce that's coming in to join an organisation that's already quite well connected is a benefit both to them and to us. There's also something about the individuals, the changes for them. What does it mean? How are they going to behave? Well, they're moving to an organisation that is in transition as well, but they are being welcomed into local authority, and we see this as a great opportunity.
It's a massive time of change for people working in public health, and local authorities are going through the same amount of massive change. It's different, but it is still change. And so what we've got is a workforce in public health joining local authorities at what to some may be a pretty scary time, but to others is a time of huge opportunity. So for me, the main challenges in that process of public health staff coming into local government is around understanding of the system, of working with politicians, and also in contributing and bringing their skills and talents into an organisation already going through a significant amount of change. We've concentrated quite a bit on the challenges. I think it's really important that we don't miss those opportunities. And that opportunity for me comes around a mixture of those skills and talents of people who have been really professional in their approach towards improving health in our communities, and of meshing that with the skills and talents within local government who know those communities well. And I think that will produce massive benefits.
So what do councils need to consider as the public health workforce transfers?
I think it's also really important that we take time in a time when there is a constraint for all of us, but to make time in order to ensure that everybody within the system, both people working within local government and working within public health, are able to understand each other's backgrounds, understand each other's challenges, so that we can start to develop those shared goals and shared vision and shared understanding. And most importantly for me, a shared culture. I'm absolutely convinced that the one thing, regardless of organisational differences, the one thing that will bind us together is that shared vision to improve the health and well-being of our communities. And that runs through all of the local authorities and runs through public health. And if we start from that very solid foundation, then I think building on the practical support of everybody in the system to understand the systems and processes, to get in tune with the politics and to understand how we can make a difference together will be really important to make sure that it's a success, and I'm very confident that we'll be able to do that.
And how can public health teams support councils?
Yeah, I think the other things that the public health team can bring is quality evidence and information and analysis that will help inform the way in which the Health and Wellbeing Board is developed. And it's also about making sure that we use that information to assist the clinical commissioning groups, but also the wider local authority in what their commissioning intentions will be.
For many in this transition, it will be the first time they'll be working with politicians.
It's also worth recognising that actually politicians are community connectors, and if you can harness this, understand what makes politicians interested in their wards, interested in their portfolio, then you can better support them to be effective within their communities.
First and foremost, to remember that they are human beings. I think there is some kind of mystique around elected members for people who are not used to working with them. And when I say that, they are not only human beings, they are people who are passionate about their communities. Their reason for giving a significant amount of time in a voluntary capacity is to ensure the quality of life of their communities are actually improved.
Councillor Pat Wright of Warrington Council explains the importance of working closely together.
The benefits of working together is to forge strong relationships. Members know where the needs of the communities are, and I think by working together they can combat certainly the health inequalities.
So what are the top tips for working with politicians?
First of all, I would say ensure that you listen carefully and enter into a conversation with elected members about what they are trying to achieve and how you can assist them in achieving that. Second is to ensure that when we are explaining things to elected members, we do so in a way that is simple and is accessible to them. We all, and currently within local government it's no different, we can all stray into jargon. And the one thing that certainly I've learnt over many years is the first thing that will turn off elected members will be if you talk in jargon that is really only accessible to professionals or people working in the system. And what it means, therefore, is they're not able to engage fully in that debate. And the third is to provide options. Always look to see if there are choices to be made and decisions that you're looking for from elected members. If there is a range of options, then give them those options and then give them the advice that enables them to make an informed choice. If I had one thing that I would say to people who are coming into local government is embrace the opportunity. And if I had one thing to say to people in local government, it is welcome our new colleagues with open arms and really learn to share that knowledge and expertise.